So do I have IBS or I have IBD? It's a big question. It's an important question and a world of different way of managing it depending on what it is. IBS is Irritable Bowel Syndrome and IBD is Inflammatory Bowel Disease. As you can hear it from the first I, irritable versus inflammatory, it tells you that the management is going to be different and the disease course is going to be different between the two. So Irritable Bowel Syndrome does not have inflammation as much. We're learning there may be minimal inflammation there, but it's not something major or significant inflammation. What is inflammation? Inflammation is when the bowel wall is irritated, not just irritated, but irritated to the point that there is damage to the lining of the wall of the bowel. And the damage is because of all the cells, the white blood cells that gather there, and there are different kind of lymphocytes involved, the different kind of immune cells that gather there and secrete a lot of chemicals. And that idea behind is to contain the damage, but at the same time the damage happens. So there are two types of T lymphocytes. There are pro-inflammatory lymphocytes and there are anti-inflammatory lymphocytes. Ideally, in an ideal world, the gut manages these two. There's a perfect harmony and a balance between the pro-inflammatory and the anti-inflammatory markers or anti-inflammatory and pro-inflammatory, what we call cytokines or molecules. They keep each other in check. Everything has its check and balance. So if this harmony, this balance is disturbed and there are either more pro-inflammatory molecules or there are less anti-inflammatory molecules. So either the regulation is not tight enough or the inflammation is too strong for the regulation to manage. So you can imagine a town where there are criminals and there are police officers or law enforcement agents. In this town where there is a lot of crime, there are two possibilities. Either the criminal gangs are too strong or the law enforcement is too weak. Take this analogy to understand why inflammation happens inside the body and you will know. So for example, Crohn's disease and ulcerative colitis, they are under the umbrella of inflammatory bowel diseases or IBD. There the inflammation cascade or the inflammation is going out of the way, like crimes are going beyond control. That happens inside the body and it causes damage to your bowel. Chief amongst them, the big mobsters are molecules like TNF-alpha, tumor necrosis factor alpha. Once it was found that TNF-alpha is a very strong molecule that causes a lot of inflammation, then all the medical research started focusing on that molecule and came up with real amazing biologic medications to target that molecule. And today, the patients with Crohn's disease are living a much better life compared to just 25, 30 years ago when we didn't know who the big players were that were causing mischief inside the bowel wall. So again, there's a lot to understand. Why TNF? What's pulling and pushing? What are the other molecules? So now the target keeps changing. We're looking at blocking this or blocking that, agent that causes inflammation. A different pathway of the inflammation, we're causing blocks to stop the inflammation from happening or to bring the lining of the wall back to health. So these are the conditions called inflammatory bowel diseases. It has a dietary change role can be made for that. There are ways we can treat it by enteral nutrition only, eliminating all the diet, changing the diet to very, very basic can sometimes help. But if the disease has gone far enough, then to bring it under control, sometimes you need steroids and sometimes you need these molecular biological agents that help. Luckily, many of these biologics have been found to be very safe. So we use it in children a lot and they have amazing results. So don't hesitate if you're concerned that whether you have IBS or you have IBD, check with your doctor, check with your gastroenterologist and discuss. Few things I can let let you know about these conditions where the red flags are extremely important for you to understand. With irritable bowel syndrome, you are not going to have these red flags. And if you have these red flags that I'm going to be talking about, then you are likely to have IBD or inflammatory bowel disease like Crohn's or colitis or ulcerative colitis. These red flags are blood in the stool. If you're pooping blood, if you have a lot of abdominal cramping which is not going away, it's waking you up in the middle of night, you're losing weight, your appetite is going down, your energy level is going down, you have pain in very specific parts of your body. You may have joint pains, your knees or ankle are hurting and they are swelling up. That's arthralgia or arthritis, we call them. Or you have a rash of some kind which is not going away. You have fevers off and on that are not explained. And of course, as I said, weight loss. And when the blood test is done by your primary care doctor, you may have anemia. Your iron is low because you've been losing through your stools or through your bowel movements, you're losing blood. And in a test where we look for proteins in your blood, your albumin is going down. We call it hypoalbuminemia, which means your albumin level in the blood is going down. And there are inflammatory markers in the blood like CRP, C-reactive protein, and ESR. Those start rising and your platelet count is rising. That we call it an acute phase reactant, which means something inflammatory or infectious is happening when the platelets go up. So when you have these kind of biomarkers, changes in your blood, your primary care doctor should be suspicious with these kind of symptoms and red flags that you need a gastroenterologist to make an immediate diagnosis. This sounds like inflammatory bowel diseases. This is not your run-of-the-mill IBS or irritable bowel syndrome with bloating and cramping and diarrhea. And yes, we can be very miserable with IBS, but at least IBS is not inflammation bad enough to need significant focus, attention, and treatment. Very specialized treatment. So that is my story about discriminating or differentiating between irritable bowel syndrome and inflammatory bowel disease. Thank you for joining me. As always, this is Dr. Sal with Gut Savior. Any questions or comments you have, please let me know. Subscribe and visit my website, gutsavior.co, for more information, or if you need more attention, I would be happy to help. Thank you.